Hi, yes, great to meet you, Samantha. I'm Dr. Johnstone. What brings you in today? Hi, yes, great to meet you too, doctor. I'm just in today to talk about how I'm pregnant for the first time, and I'm just super stressed and tired and confused, and I don't know what to do. Was this a planned pregnancy? No, doctor. And about how far along are you now? About 5 weeks now, yeah. Okay. Do you know if you've been exposed to any teratogans? Teratogen being anything that can negatively alter the baby's cognitive or behavioral functions. Just wondering because right now your baby should be in the embryonic stage, and that is when it is most vulnerable. Well, sometimes I go out to the bar and we do get some drinks and all, but I swear as soon as I found out I was pregnant, I just stopped binge drinking altogether. Now I just might have a glass of wine every other night or so, because I read on the internet it wasn't that bad. Okay, so then when did you find out about your pregnancy? First found out about 2 weeks ago. Right. So my personal recommendation is to just avoid alcohol altogether. At the time, that would have been week 3 of your pregnancy. Still not too good. Fetal alcohol syndrome is a serious problem for babies, and it can cause things such as facial deformities and heart defects. Not something I would rather have. Do you know if you've been exposed to any cigarette smoke? I'm just wondering because even that can cause something called SIDS. Even just a singular puff of a cigarette, it can cut off up to 25 minutes of the baby's oxygen. Okay. Now, none of my friends have smoked around me, and I'll avoid the ones. Very well. Now, can I ask you about your nutritional health? How have you been doing there? It's okay, I guess. I haven't seen a big appetite increase, which I expected being pregnant. If anything, my appetite's kind of gone down. I think it's because of the morning sickness. Alright, well, this is a usually typical response of a lady in her first trimester of pregnancy. Come your second trimester, though, I recommend a calorie uptake of about 300 calories. And I also recommend folic acid as well. Now, normally it's taken early in pregnancy, but there is no harm in taking it now. It provides many great benefits, such as decreased risk in premature births, as well as behavior problems. And it also has a decreased risk in defects such as spina bifida. Okay. So how much of this folic acid should I take a day? And when should I stop taking it? Very good questions. I recommend 400 microdoses a day. When to stop taking it? You could stop taking it week 12, because that's when the spine is fully developed, so the risk of spina bifida kind of flatlines at that. However, there's also no harm in taking it past week 12 as well. Samantha, do you have a job anywhere? And if so, how are you finding it? Yes, I do work. I do provide for my family. I'm a chemical operator at Greenfield, just over in Chatham, Ontario. Are you aware of any possible chemicals you might have been exposed to in the workplace? Mercury, lead, carbon monoxide? Mercury, I believe, yeah. I personally recommend work from home if possible. If they can't allow that, maybe just a safer sector. As mercury is very detrimental to the baby's central nervous system and brain development. And because I don't know how much mercury you may have right now, I recommend cutting off seafood from your diet, as some can have very high levels of mercury. Dr. Johnstone, I've also been very stressed out about everything. I need to change my whole lifestyle, my diet, my job. I don't know how I can deal with all this stress, quite honestly. I feel like I'm shutting down. Stress is a normal thing, Samantha, especially in your situation. I'm going to recommend some things we can do to help lower the stress levels for you and your baby. So, doctor, you're telling me that my baby is experiencing stress as well? Yes, your stress levels do affect the babies. In fact, it can cause many problems such as behavioral or cognitive issues and ADHD or even a language delay. Now, normally stress doesn't play a part in your baby's life till the fifth, 6 month, but we're not going to wait till then. We're going to try to alleviate some of that stress right now. Okay, wow, awesome. So what exactly can I do? I personally recommend exercise. Walking or yoga are great for constipation. I suppose that exercise is very beneficial for the mental health. Okay, yeah, that sounds easy enough. A counselor wouldn't be a bad idea either. Just talk about your personal life and any exercise or nutritional programs you'd like to get into. That sounds nice. Support systems are also a great way to meet other women that are around the same stage of pregnancy as you are. They consist of about 90-minute sessions of self-examination, and they definitely help a lot of women through their pregnancy. Okay, yeah, I'll definitely have to look into that. Thank you, Dr. Johnstone. You have helped me out so much today just with your guidance and counseling and telling what to do and what not to do. You've definitely relieved a whole lot of stress and pressure on me, and I thank you so much for it. Of course, that's what I'm here for. Now, it was a pleasure meeting you, Samantha, and I recommend you follow the guidelines we went through today, and hopefully that increases the chance of a more successful birth. Now, I'll write you that doctor's note for work, and we'll be on our way.